In a unilateral move, Singapore will lift border restrictions to travellers from Taiwan starting next Friday.
A 14-year-old boy has been arrested for allegedly killing his father.
In a major setback, GSK and Sanofi says their COVID-19 vaccine will not be ready until the end of next year. Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Haryanto Diman. You can subscribe to the Straits Times channel so you never miss a single episode.
Well, 8 new COVID-19 cases confirmed today. They included 1 case from a workers' dormitory, but none from the community.
The remaining 7 were imported and had been placed on stay-home notices or isolated on arrival in Singapore. More details will be released tonight.
Well, from next Friday, visitors from Taiwan will be able to come into Singapore for all forms of travel and not be quarantined. But this is subject to them testing negative for COVID-19 on arrival. The same applies to Singapore citizens, PRs and long-term pass holders returning from Taiwan. The opening is unilateral as restrictions in Taiwan remain in place, with leisure and social visits by foreigners currently banned.
Meanwhile, a Singaporean woman who allegedly left her residence to buy bubble tea while serving a stay-home notice was charged today. 22-year-old Nurul Afika Muhammad was supposed to serve her stay-home notice from March 21st to April 4th, but is said to have gone out on multiple occasions, exposing her friends and others to the virus. Not only did she leave her Woodlands Drive residence to buy bubble tea at Causeway Point 2 days into her SHN, the Immigration and Checkpoints Authority accused Nurul of travelling to Punggol Field to help her friends with wedding preparations on April 2nd and 3rd. She also allegedly visited other public places. Nurul is facing 7 charges under the Infectious Diseases Act and she intends to plead guilty. She'll be back in court on January 22nd.
Well, more local headlines coming up, but first, Singapore will be pumping a record $25 billion into research and innovation over the next 5 years. The Research, Innovation and Enterprise 2025 plan will focus on 4 key areas: health, sustainability, manufacturing and the digital economy.
Announcing this blueprint earlier today at a virtual press conference, Deputy Prime Minister Heng Swee Keat also said that a portion of the budget will be set aside for new areas of research which may arise.
Given the rising speed of change and our evolving needs, our RIE 2025 plan will set aside 15% of the total RIE budget, or $3.75 billion, as white space. This will give us greater agility and nimbleness in responding to emerging priorities, new breakthroughs, and changes in the global technological landscape. The COVID-19 pandemic has thrown the world a curveball, but it has also offered a model of how we can work together and leverage science and innovation to overcome our common challenges. I'm confident that this will drive economic recovery and growth and address our broader national needs.
Well, health and biomedical sciences will be expanded to address Singapore's rapidly aging population.
Areas of focus include improving prenatal and early childhood development, learning outcomes in children and adults, as well as the health and contribution span of seniors.
One new exciting area of work that we are doing in this domain is to expand the health and biomedical science domain to now cover human potential. It is especially pertinent for Singapore that we are doing this because our only available natural resource is our people. Through R&D in this area, we will know better what interventions we can make to achieve meaningful, active and productive longevity.
Meanwhile, manufacturing will be expanded beyond advanced manufacturing to include trade and connectivity.
Greater emphasis will be given to climate change, decarbonization and the transformation of our built environment.
In the digital sphere, Singapore will ramp up key technology areas like AI and cybersecurity, as well as better integrate technology and governance.
This year has been a digital watershed. Many years of digital transformation has occurred in the space of several months. And in Singapore, for example, the e-payment transaction volume has tripled, and the number of enterprises on our e-invoicing network has gone up 20-fold in this period when we've had to put up with COVID. So in RIE 2025, we will accelerate the development and translation and ultimately the adoption of key technology areas such as AI, cybersecurity, trust technologies, communications and connectivity, and quantum computing. All of these will undergird the next bound of economic growth in the near term as well as in the medium to long term.
Here to tell us more is Science and Environment correspondent Audrey Tan. So $25 billion over the next 5 years into 4 key areas: health, sustainability, digital economy and manufacturing. But Audrey, does this chart a new path in Singapore's research focus, or are we building on existing trajectories?
So the 4 pillars are not new, and we've already seen Singapore's investment into these 4 areas in previous RIEs. Like for example, in 2020, RIE 2020 already saw investments into these 4 areas. But what's new this year is that each of these pillars will be expanded in the scope to meet new national needs. So for instance, in terms of healthcare, we've already seen how Singapore's investments into the health and biomedical sciences has put us in good stead to overcome the COVID-19 challenges. So now it's going beyond that to also include things like human potential. So talk about longitudinal studies to get better understanding of how maybe I could say quality of life can be improved. In terms of manufacturing, now it's no longer just about how we can make manufacturing itself more efficient and more productive. It's also about boosting Singapore's links with the rest of the world in terms of enhancing our air and maritime links, for instance. Sustainability too will also see a new focus in things like dealing with climate change and technologies to cut our carbon footprint. So I would say that the focus is kind of the same, it's just that each of these areas would now be expanded in scope.
Right. And your area of focus is science and environment, Audrey. Anything particularly promising or exciting that will come out in the next 5 years?
So in terms of sustainability, there are like about 4 new different approaches to dealing with urban solutions. Climate science is one, so trying to improve our own talent pool or our better understanding of climate science and how it affects Singapore. But what I found interesting was that more investments were being made into decarbonization technologies. With all this talk about COVID-19 and the impact it has had on economies, scientists are warning that if nothing is being done to deal with climate change, which is caused by human activities, the changing climate, extreme weather events could kind of wreak the same havoc on human society and economy as did COVID-19. So developing low carbon technologies, whether it's be using green hydrogen as a fuel, it does not produce carbon dioxide as an emissions when it's burned, or other kinds of technologies like carbon capture technologies where you capture carbon dioxide being emitted by factories and then you capture it to store it underground or to convert it into other useful substances. These are technologies that are interesting, but it's still very nascent worldwide. So the fact that Singapore is investing into this area, I think it's definitely an area to watch, because not only will it cut our own carbon footprint, we could potentially export these technologies for other cities looking to do the same.
Right. A new national research program for epidemic preparedness and response was announced today as well. You spoke separately with Chief Health Scientist Professor Tan Chor Chuan on it. What did he say about how this program will help Singapore's defences against future disease outbreaks?
Yeah, so the PREPARE program is also interesting. And I guess in terms of the new programs, based on my conversation with Prof. Tan, I took away 3 kind of key areas. So the first would be enhancing surveillance of potential pathogens that could impact human health. So we know that many of these viruses that are affecting humans, whether it's this SARS-CoV-2 or the virus that caused SARS, they actually came from animal populations. So by working closely with other scientists in our region, we would have a better surveillance network about the potential of other viruses coming up, and that would give us ample time to take precautions. So surveillance is one. Secondly, he talked about bringing capabilities together, like in terms of the scientific community. I mean, we always talk about them as one cohesive whole, but within the community itself, you have different scientists from different institutions. Each of them have their own areas of expertise. So he says that this new program would kind of bring all these scientists of different expertise and backgrounds together, and that could help speed up the development of diagnostics, therapeutics of vaccines. And this is important because when you talk about dealing with a pandemic, an infectious disease, you would definitely need people from more than one expertise. So the example he cited was, for example, in developing a diagnostic test kit, you would need someone who with understanding of biology, like the virus and the pathogens, but you also need someone who would be able to do microfluidics. So it's a field of science where you have a very small sample and you would need to know how to manipulate it, like in the case of a diagnostic test. So that's interesting. Another third area would be, he said that funding could be provided under this new program to build national infrastructure for the long term. So it includes things like, data storage, so that data could be stored securely and accessible to researchers who need this data in order to do their scientific work. And also potential biobank, for instance, where you can store samples that are needed, clinical samples, biological samples, and all these are important. So Prof. Tan also talked about one example where, during the COVID-19 situation, we saw many research groups coming up with diagnostic test kits in terms of serology tests, antibody tests. And one thing that was useful was their access to patients who had SARS back in 2003. Their patient serums was used to kind of like validate the test and see whether there was no cross-reactivity, since the virus that caused COVID-19 and the virus that caused SARS are from the same family. So all these are really interesting nuggets of information that he shared, and it will definitely boost our preparation to deal with future outbreaks in the future.
Right. Well, thank you so much for joining us, Audrey. That was Audrey Tan, Science and Environment Correspondent for the Straits Times.
Moving on to other local news, a 14-year-old teenager has been arrested for his suspected involvement in the murder of his 49-year-old father. The police said today that they received a call for assistance at a residential unit in Flora Road shortly after 10 a.m. Upon arrival, officers found the man injured and lying motionless. He was taken to Changi General Hospital unconscious, where he later died. The teenager was arrested at the scene and will be charged in court later today with murder. Police investigations are ongoing.
From next Friday, December 18th, Grab will start charging a platform fee of 30 cents. It's inclusive of GST and will apply to all Grab rides except those from Grab Hitch and Grab Response. It's the first such move by the firm to adjust its ride-hailing prices since the Competition and Consumer Commission of Singapore lifted restrictions on it in November. Grab said 2/3 of the fee will be used to improve safety and security, among other things. The remaining 1/3 of the fee will go towards initiatives to support drivers, which include benefits and training allowances.
Mark your calendars for February 23rd, because that's when Walt Disney's streaming service Disney Plus will launch in Singapore. The service will carry titles from film brands like Marvel, Pixar, Star Wars, Disney and National Geographic. It will also carry the Star brand for families and older teenagers. And this will make Singapore the first market globally to launch with all 6 Disney Plus content brands. The service is priced at $11.98 a month or $119.98 a year.
Moving overseas, Hong Kong has signed a deal to buy 15 million COVID-19 vaccine doses from 2 front-runner companies and will receive the first shots beginning next month.
Chief Executive Carrie Lam shared this at a press conference earlier this afternoon. She also outlined new COVID-19 measures for travellers expected to return to Hong Kong for Christmas.
Meanwhile, the city is already currently under stricter COVID-19 rules, which started from yesterday and will run till December 23rd. Now to recap, dinner dine-in services will be stopped between 6 p.m. and 4:59 a.m. the following day. The cap on patrons per table during dine-in hours remains at 2.
Businesses like gyms, sports centres as well as beauty and massage parlours must also close from 6 p.m. Banquets will have to cut capacity from a maximum of 40 patrons to 20, while more civil servants are to work from home.
Let's get the latest on the ground with our Hong Kong correspondent Claire Huang. Claire, what's the latest you're hearing about Hong Kong vaccination plans?
So the earliest Hong Kong can get vaccines will be early next month. That will be from Sinovac, Chinese manufacturer. And then sometime in Q1, first quarter that is, will be Pfizer and Biotech. And then in Q2, we're expecting doses from AstraZeneca's vaccine that's developed with Oxford University. So the idea here is to vaccinate those who are most vulnerable, such as the elderly, especially those with chronic diseases. So those in nursing homes, care homes, and then children and then after that by age groups. Also, in the briefing earlier today, the government said it has identified 36 hotels for quarantine. So anybody who's coming back to Hong Kong will have to serve quarantine no longer at home, but in the hotels that are designated. You've got about 12,100 rooms. It's a 14-day stay for those returning to Hong Kong, and this starts from December 22nd. 80% of the rooms are Hong Kong $2,000 or less. There's about $400. So there is a whole range of steps accompanying this quarantine, such as designated transport to ferry people from wherever they come from, and then go to the hotels. And then there are samples for testing. Multiple tests will be done. So Secretary for Health, Sophia Chan, gave an update earlier on the situation, saying that, a lot of people infected are housewives, students, all districts are affected, age group are getting younger, and so far 75% of the public hospital beds are filled. So the burden on the public healthcare system cannot be ignored.
I see. Well, when we last spoke about a week ago, Claire, people were still going about their daily routines, but are you seeing that more people are staying indoors, especially at night, now that stricter measures have kicked in?
Well, some of the toughest measures we've had here, like no dining in services at eateries from 6 p.m., and closures of more than a dozen type of venues like gyms, sports centers, massage parlours, as well as the closing off of beaches, public leisure facilities. They have been reimposed to counter this new wave. We are on our way to the peak of this new wave. So yesterday was the first day these rules kicked in. Today is the start of a new rule where you've got a 5,000 Hong Kong dollar fine. That's about 860 Sing dollars, for breaching the rules. So in general, there are fewer people on the streets, and last night I walked in Central, you have people carrying bags and bags of takeaways. There's not much of a choice because restaurants have to close, their doors to walk-ins. So business is expected to be brisk for, supermarkets, food delivery platforms, as we go back to cooking and ordering online.
Right. And how are authorities ensuring people are abiding by COVID-19 rules? Are there safe distancing ambassadors like that in Singapore?
That is a very Singaporean mindset, that we need ambassadors to instruct us what to do, right? Well, whatever works, right? It may be something that makes us unique, but in Hong Kong, we seldom have that. We have the occasional mall security or staff who will tell you to wear your mask, while you're trying to take a sip of your drink. But mostly we have cops, police officers who have been patrolling and stationed at various places, right, to look at the crowd, to observe. They will do spot checks on the F&B outlets. I have heard of them, going in Central, doing their spot checks, and, when they get there, they close everything, they cordon it off if they know they can see, right, the number of people in that small eatery, and everybody gets a fine. And the business gets a fine. So, now you also have the government with more powers. It can seal off a premise that has outbreaks to prevent people from moving around and spreading the virus, and it can order mandatory tests. So powers have been beefed up.
Right. Well, those are some important things to note of, I guess, when Singaporeans, eventually make their way to Hong Kong, if and when the travel bubble resumes. So thank you so much for the updates, Claire. We've been speaking to Claire Huang, Hong Kong correspondent for the Straits Times.
In other global headlines, Sanofi and GlaxoSmithKline said they need to study if a retooled version of their COVID-19 vaccine candidate can produce better results among older people, and this will delay its potential availability to the end of 2021. They'll begin a new second phase study with an improved product in February. Britain and Canada have already approved a shot from Pfizer and BioNTech, with the US and Europe possibly following suit soon. China and Russia have already begun administering their own vaccinations.
Good news for those of us who love Bali. According to the United Nations World Tourism Organization, the resort island is ready to welcome international tourists before Christmas. The agency's team had seen firsthand the implementation of health and safety measures to prepare for the island's reopening and found the standards and safety protocol to be, quote, excellent, if not the best there are.
US President-elect Joe Biden and Vice President-elect Kamala Harris are Time Magazine's Person of the Year. The pair were chosen ahead of three other finalists, the frontline healthcare workers and Dr. Anthony Fauci, the racial justice movement, and President Donald Trump.
Meanwhile, K-pop sensation BTS was named Entertainer of the Year, capping the group's breakthrough year in the US, which included a first major Grammy nomination for a K-pop band.
The National Heritage Board has put together 19 heritage trails that cover various neighborhoods in Singapore.
And 4 reporters from Live road tested the trails. Their top 5: Balestier, Tiong Bahru, Queenstown, Kampong Glam and Pasir Ris. Here are 2 of the trails. Well, if you're watching us on YouTube, there's a link in the description below where you can check out the other trails.
Our colleagues at Live have included the duration and difficulty of each, as well as picked out some highlights.
Well, for more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Now enjoy your weekend and we'll see you next week.